The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, good morning, everyone, and thank you for joining. And welcome to the second webinar together with Tatiana Brandt. And the topic of today is how to prevent work-related hand and wrist injuries during periodontal treatment. During our first webinar last week, there was a question if we could share the references. And those have been now added to this webinar as a handout. On the right-hand side, you should be able to see the list of references, and you should be able to download it. Also, as a reminder, in case you weren't able to attend the first webinar of the session, so it has now been placed on our website. So if you go to lmdental.com, you should see a link with Tatiana, and if you click on that, you'll be able to access the video and watch it later on. As last time, you will be muted throughout the session. However, you have the possibility to ask questions. You can do so by typing them in on the right-hand side. There's a question field. Also, at the end of the session, we will have a Q&A session. And there I will read your questions for Tatiana. And also, if you prefer, you can also then raise your hand. On the right-hand side, there's a raise your hand icon. By clicking that, I'll be able to unmute you and you will be able to ask your question verbally. Okay, let's get started. I'm going to hand it over to Tatiana. Go ahead, Tatiana, and please start your presentation.
Hello, everybody, and thank you for joining to the second part. And as I told you, it's the first webinar when our hands don't work. We don't work. Unfortunately, evidence-based choice of periodontal instruments is something dental school don't teach. So let's talk about it today. So, how to prevent hands and wrist injuries during periodontal treatment? You can find some information about me on this slide in case you have some later questions about periodontal instrumentation. Dental practitioners are at a very high risk to develop musculoskeletal disorders. Work-related injuries in hands, wrists, and fingers cause dentists, dental hygienists, and assistants pain, numbness, and other symptoms which lead to loss of work time and early retirement. Dental hygienists suffer from pain in hand, wrist regions more than other dental professionals do. It's very difficult to recover from these work-related injuries, comparing to other in back and neck. The statistic shows that we are not very good at prevention. That is a very sad situation. Should we be concerned? Why is it happening? Maybe it's a lack of awareness, maybe it's a lack of time, or a lack of education. I don't know. The good news is the most of pain can be prevented, and most injuries can be prevented by paying more attention to maintaining of periodontal instruments, some with other methods. There are three main approaches to preserving hands for long and productive dental careers. It is basic ergonomics and working with the right equipment and using the right techniques, some physical exercise and pauses between treatment for recovery. There are only few articles listed the problems associated with periodontal instrumentation. I'm trying to summarize them today in the following slides. The problems include Forceful exertions, repetition, small diameter instrument handles, flexion and extension of wrists, and pinch forces. You can see the awkward hand postures or unsupported positions can also lead to compressing nerves and irritation of dentures. Excessive vibration, usually from vibrating tools, can decrease blood flow, damage nerves, and contribute to muscle fatigue. Inadequate recovery time due to overtime, lack of breaks during scaling, and failure to vary tasks can leave insufficient time for tissue repair. Some is the biggest problem for us. It's increasing specialization that requires the worker to perform only one function or movement for a long period of time or day after day. This is a very big risk factor. But to contribute to musculoskeletal disease, these risk factors must be presented for sufficient duration and frequency. Are you in pain because of some of these reasons? Or do you want to prevent the work-related injuries? Here are some recommendations and tips on what to do about it. Let's get into the specifics of these risk factors. Let's see how we can avoid the awkward hand postures. Ideally, you need to keep neutral hand position, which means that your wrist is aligned, like it's showed on this picture, with forearm, and forearm held parallel to the floor. It's what is recommended in the most of books. But you can see if your elbow a little bit higher than your hand, it's also okay. It's also quite comfortable. The next one, you need to try to avoid unsupported hand position. Try really hard to break your habit, whether you are sitting or standing. I always try to support my hands on patient cheeks and chin, something what wasn't accepted for 15 years ago, but what we are teaching students to do right now. Ideally, we want the room to be big enough to permit clinician to move freely around the chair in all clock positions, and we teach students to work in different clock positions. So a lot of space is the best preventing for awkward postures. Some books recommend limiting use of 7 o'clock to 8:30 o'clock or 3:30 to 5 o'clock position as much as possible. I'm not agree on this recommendation. If you take care of the chair is parallel to the floor and the patient's chin is raised up as shown on this picture, when you're working on maxilla, these clock positions are going to be just fine. I love working in the 8:30 position, providing that my hands and fingers are well supported. You don't need to worry that this position is uncomfortable for your patient. Most of people accept it without any problems. Of course, there are some exceptions, but it may be just 1 or 2 patients per day, not 15. Look at this image and then look at your own hand. Your hand has 2 sides, little finger side and thumb side. Little but very important detail, little finger side of palm needed to be slightly lower than thumb side of palm, as shown here. It is the best position for your hands when working with periodontal instrumentation. Try to avoid thumb side of palm, rotate it down so that palm is parallel to the floor. You can see on this picture, it is the wrong position. You should not bend your hand and wrist up or down. Try to find the proper position around the chair. if you notice you are bending. It is a good visual reminder. If you are starting bending your hand, change the position, either yours or your patient's. The patient's head should be positioned to facilitate neutral arm, wrist, and hand position for the clinician. The patient's head may be neutral, straight, or turned toward, away from the clinician. We are educating in our school a lot about head position, with the patient's chin raised up. You can't see it in another books because when you look in another education books, you can see the patient is sitting in the chair, slightly laying. But this position, it proves better visibility and access to the treatment area. Even old patients find this position quite acceptable. This position is only for working on maxilla regions. The patient is only in the dental chair for 45 to 60 minutes, while the clinician works at chair side throughout an 8 or maybe 10-hour stay. At times, it may be helpful for you to use a standing position rather than a seated position. A standing position can be used when there is difficulty accessing the treatment area, when the patient cannot be placed in a supine position due to medical or physical contraindications, or when working on mandibular treatment areas. I personally always change between sitting and standing position. It's really nice for the body for improving the blood flow. And now, when we have those basic ergonomics rules down, let's talk about my favorite part, periodontal instrumentation. I love these pictures. They're really illustrating the technology progress in dentistry. Look at these instruments. Nobody talked at that time about the patient laying down or wearing gloves or masks. The female dentist, she is smiling. She does not know that women are 4 times more prone, 4 times more predisposed to developing of musculoskeletal disorders in wrists than men, probably because of the bone structure, and frequency is highest in team members for 35 to 55 years of age. Using the right instrument is an important factor in preventing physical job-related problems for dental practitioners. Dental practitioners work with their instruments all day long, so the quality of the instruments must be superior. I think the dental ergonomics should be an integrated part of curricula and continuing professional development programs. But one thing is education, another is economical reasons. I know a lot of dental hygienists which do not have access to acquire a few new scalers or curettes. It can wonder me because in most cases it's not any major investments, considering that dental hygienists contribute to the turnover at the clinic and to the patients get a good experience of a treatment. So today I want to ask you, how do you choose your instruments? Is it evidence-based choice of instruments or is it your preference? I hope then help me with the poll questionnaire about this question.
Yes, thank you. So I've now launched a poll, and I appreciate if you could answer the question here. So on what basis do you choose periodontal instruments? Is it evidence-based or preference-based? Let's leave it on for a while. Please click your vote. Okay, I'm gonna close the poll and share the results. And that's a very interesting result. So we see the results here, and 51%, so it was really tight. 51% is evidence-based and 49% is preference-based.
Yes, and it's very nice thing because it's the same with scientific research. They are measuring the muscles force on the instruments, but also the preference. So it's totally as it's saying in the scientific literature. But it would be preferable if we choose our instrument based on evidence recommendation. And then that's why we are going further with how to choose periodontal instruments. What do we need to be aware of? So the experts suggest the dental hygienists, and I would also mean dentists and dental assistants, should be educated to select a variety of instrument handles based upon the parameters described in the following slides. Let's look at this. According to some researches, and you can always see the references on my sites, it's here, and you'll find a lot of other on another slides. The optimal diameter for dental instruments and mirrors is at least 10 millimeter, and the optimal weight is 15 grams or less. And padding decreases muscle activity. About this padding, which means using of soft materials, choosing a medical silicone handle with a large diameter is the best solution, I think. But it's also supported with a lot of studies. The instrument with a large diameter, 10 millimeters, and a light weight, like 15 grams, which is recommended in this study. Another study says 16 and up to 20 is also acceptable, requires the least amount of muscle load and pitch force. The design of periodontal curette handles may even cause or aggravate arm pain in dental practitioners, which means it's not only recommended to choose the best design, it's recommended to avoid the not fitted, ergonomically fitted design. It can be not very balanced instrument or very heavy instrument, and very important here, narrow handles. It can be also very bad for our hands. It can lead to developing of musculoskeletal disorders. So try to avoid working with that kind of instruments and look at the diameters. These mentioned studies emphasized the lighter and thicker instruments are the best options to avoid musculoskeletal disorders. Alongside the diameter size and the weight of the instruments, using the sharp instruments is important to reduce the squeezing force during the scaling. Key factors for hand health are as follows. Sharpness. Sharper is better. Instrument width. Wider is better. Weight. Lighter is better. And medicine silicone padding. And besides this, you need to consider handle shape and instrument balance. According to these mentioned studies, ergonomically designed dental instruments for scaling and root planing may help reduce the prevalence of carpal tunnel syndrome among dental practitioners. And this syndrome, it was something I was talking about in my first webinar. The instrument handle with a tapered round shape and at least 10 millimeter diameter requires the least muscle load and pitch force during simulated periodontal work. Another study compares the effect of 4 commercially available periodontal instruments handle design on arm muscle activity during a simulated periodontal scaling. And that study included working on multiple teeth, not only on one, and in all 4 quadrants of the mouth. So I would recommend to choose no slippery sharp lightweight instruments with appropriate handle size and surface texture to distribute this pressure. Because the main reason you are choosing the wide diameter, because you are distributing pressure you are putting on the instrument while scaling. So big diameter helps to distribute the pressure. And this diameter may be even more important than weight, but it needed to be investigated. In another study, evaluation of efficacy of instruments in dentistry, 5 different models of Gracie curettes used for scaling and root planing were evaluated to determine their ergonomics and efficacy. The focus was on usability, muscle strain, muscle activity, postures of upper limbs, and work productivity. And the 2 most available instruments, according to the participant, and they were asking about their preferences, it was A and B. It was the instrument with the thickest silicone handles with 14 and nearly 12 millimeters, this A and B from LM. The participants reported that the instruments with the thickest and second thickest silicone handles caused the lowest strain, both for the fingers and palm, and for the thumb. So work productivity was also improved using the thicker handle instruments. And in this study were both dentists and dental hygienists who participated. Modern instrument design consider ergonomic adjustments, including increasing the handle diameter, reducing the weight, and improving the balance of instruments, adding padding, adapting the shape and texture of the handle, and varying the handle diameters of the instruments. All these adjustments have been made to instruments to reduce forceful exertions and pitch forces. So why don't you use and choose the new design of instruments to prevent injuries? That was about the instrument design. Another consideration is about instruments choice is that the dental practitioners are not the same. Many dentists play golf and can probably answer this question. Should these 2 golf players use the same golf set? They have different experience, different size of arms and hands. And you can see my son and my husband in these pictures. They're actually paying for learning fitting of their golf equipment because they want to improve their game. So if you want to improve your periodontal treatment, you need to consider the size and anatomically differences of your hands. You can see my colleague's hands on this image. Different size, different finger lengths, and other anatomical differences. And the same as here, anatomical size differences. It's my hand and my colleague Malina's hand too. And now I'm going to talk about another problem. It's hypermobility of our joints. About 30% of dental practitioners have hypermobility. They're especially in a risk zone. Clinicians with joint hypermobility typically need to increase the use of the muscles in order to maintain neutral positions, proper grasp, and fulcrums. So these prolonged and repetitive efforts to compensate for the hypermobility of the joints may cause strain and lead to chronic pain. This is my own experience that it's much easier for me with my hypermobility to use ErgoSense handle with big diameter, and what I also recommend to another practitioners. If you have this problem, you really need to avoid narrow handles. Many of us are not aware of our hypermobility. My colleague even didn't know that she was slightly hypermobile when she agreed to be a hand model. I would recommend ErgoSense handle with bigger diameter to prevent finger flexing. And now I will tell you now about my own consideration about choosing the diameter. You can choose a lot of handles, ErgoSense and ErgoMax and ErgoNom. So how do I choose? My first consideration is diameter, which is at least 10 millimeter. Another is the purpose of use and the type of grasp I'm using. The problem is that different education places use a different terminology about the grasp. Grasps for periodontal instrumentations are not the same. Often you hear the term pinch grasp and read it in some articles, which means three-finger grasp. The truth is that there are three types of pinch grasps. I'm going to focus on two, for detection and for scaling: pen grasp and modified pen grasp. I would always choose ErgoSense with diameter of 30.7 millimeters, nearly 14 millimeters, for the detecting caries and calculus or for coarctation problem, because it allows me to keep the nice distance between my index and thumb fingers, and allows keeping the handle with a relaxed pen grasp. I'm also very happy about the way I can rotate the instrument in order to adjust the tip to the tooth surface. It increases my tactile sense thanks to the silicone handle. And now it's very important thing I have mentioned before. The ErgoSense handle with large diameter prevent me and other practitioners to flex my hypermobile fingers. It's the best prevention of overload of my fingers because of this hypermobility. Modified pen grasp is mostly used as shown here for the supragingival scaling. And ErgoSense is perfect for me here because of using intraoral finger rest. You can see that the functional shaft is resting on my long finger here. Some clinicians with very short fingers can feel some challenges in using ErgoSense for extraoral fulcrum when using extended modified pen grasp. I don't have any problems with this, but if you feel so, you will probably be happy about ErgoMax handle, which diameter is about 12 millimeters. It's 11.7. The shape will probably suit you better, but it is my personal experience and my personal advice. As you can see on this image, my colleague with with a little bit longer fingers length is very comfortable with using ErgoSense handle for extended modified pen grasp. Students at our school work with different type of handles from different companies. We don't recommend some special company, but we teach them about different instruments and different handles. But we have the best experience with LM instruments because of the ergonomical design. We educate about avoiding the typical mistakes when they are working with grasp. So focus on ergonomics and instrumentation is quite big at our school. What is important to think when you are using the instrument and your modified pen grasp is not having this overlap with your thumb and index finger. And when you are using the handles with a big diameter, it's the best prevention of this overlap. And you need to think that your instrument needed to rest on your long finger close to the nail, not in the soft pillow of your finger. We have some great instruments from other manufacturers, but it is important for me to avoid any feeling of sharp edges. That is why I mostly work with this type on the left with the blue. It is LM's handle, ErgoSense, because the joint part between the shaft and handle is very smooth, is very nice. And you can see that the joint part between metal shank part and the handle has very different design. at the different companies. Another approach to preventing overexertion in hands and fingers is considering using a variety of instruments to scaling, because the calculus consistency is not the same. A variety of hand instruments designs are available to address different calculus locations and sizes, as well as gingival conditions. And when choosing the instrument, we need to consider three things: its purpose, tissue tone, and design. And very often I see dental hygienists using all too fine instruments like micro and mini, which I really love, but not for the initial debridement. Sometimes they use very thin ultrasonical tips for initial debridement, which is wrong, because you need to remove heavy calculus using some more rigid tips. A very thin working end and thin shank diameter is appropriate for adapting to light deposits and subgingival scaling, using rigid instruments with wide shank and blade for initial debridement and more rigid tips for scaling would be more time-saving. It's the best solution for your hands to start with. Yes, they would enable dental hygienists using these rigid tips to use less repetitive movements, which results in diminished hand fatigue. Next recommendation is about ultrasonic devices. Using a proper tip with a proper angle of 0 degrees would save you time and preserve your hands. So it's the same about tips of ultrasonic devices. You need to start with something rigid, and then you are shifting to a little bit thinner tip to continue. The time you use on ultrasonic scaling relies on a relationship between an appropriate tip for the task, thin for subgingival scaling or standard, or more rigid for supragingival. Think about power setting too. For the type of deposits, power setting will be in the medium or high range for the heavy calculus because of the density of the calculus. Use of active tip area, this working end, not only the tip, but 1 to 2 millimeters length, and the working end to root angle to 0 degrees. And remember, you need to replacement the tip that they are getting old and they are getting be worn out. Choosing ultrasonic, we need to think about avoiding vibration. What is most important for me when I'm using LM points, that you can't really measure any vibration on the LM ultrasonic scale of handpieces at all. This is important for me. What we know from different studies, that the excessive vibration, usually from vibrating tools, can decrease blood flow, damage nerves, and contribute to muscle fatigue. What we need to think about is the time we use on prophylaxis polishing. We are using a lot of time on this. The way we can preserve our hands from vibration is using air polishing devices. We talk always, when we are talking about air polishing devices about effectiveness and about biofilm removing, but we are not talking a lot about ergonomics, and I think that is a pity. We need to think about using air polishing as preventing our hands from injuries. And this one you can see in the picture is very nice because it's the first ever polisher with light. You can really see what you are doing using this one. And now a little case to illustrate how I work with different instruments. I will always start with air polishing. When you have this discoloration, I am removing discoloration first and using air polishing devices for this, doing something for this calculus structure. They're getting a little bit more dry and they're getting a little bit easier for me to remove. So I don't start with ultrasonical devices here. I start with air polishing. I air polish to remove discoloration, and then I follow in by rigid ultrasonic tip to continue, and then I choose a mini or micro scale to hand scaling, and always finish with Explore 11-12 to control. And now, when you have learned about design of periodontal instruments, I want you to decide which glove is better ergonomical to choose. Select of the right one. It's my hand, but you can see the left one is the wrong one and the right one is the right one. So you need to choose the right one because you can see there is a little bit more space. The glove is more loose on the wrist. You need to have place for 2 fingers when you are putting your glove on. And you can see there is also a little bit more loose structure on your palm. Also, the influence of gloves on hand discomfort has yet to be explored. They have been cited indirectly as a potential contributor to carpal tunnel syndrome. The proper fit of gloves will reduce fatigue and tension of the hand, palm, and wrist, and allow blood circulation. The gloves should feel comfortable without being too loose or too tight. And the third approach is the last one to preventing is physical exercises at home and breaks scheduling of your patients. So why I'm showing you this picture of Copenhagen Marathon? Because if you love to run, you know that you need to stretch. And that is not discussion. And the same with scaling. You are not a scaling machine. You need to have some small breaks to recover. My students love doing stretching exercises after periodontal treatment. So what about you? Here are just 2 references for inspiration. In one randomized control study, dentists performed 5-finger stretches before starting scaling and root planing. Just 5, 8 seconds each. And this intervention successfully decreased the drop in pinch stress after dentists performed scaling and root planing. You just need to make 5 stretches before starting. 5 stretches like 40 seconds, but sometimes it's difficult to find. And you can find more references on my other slides. This one is very good for inspiration for the different exercises. So now it's time for summarizing. I presented today 3 approaches to take care of your hands. I hope you will consider these approaches in the future in your clinical practice. What is important? It is the careful scheduling of patients with heavy calculus, taking appropriate breaks and stretching, selecting instruments with a large diameter and a light weight, considering scaling with rigid tips and rigid hand instruments for initial debridement, just to start with, using air polishing devices instead for rubber polishing, proper fit of gloves, ensuring that instruments are kept sharp. I love using sharpen-free instruments. It saves my time. The time for poll questions probably is now then. Shall we ask the participants about what it will be possible for them to implement in their working day?
Yes, thank you. So I've launched the second poll that we have here, and the question reads, which of the following recommendations could you implement in your daily dental practice? Planned scheduling of patients with heavy calculus, selecting instrument with large diameter and light weight, considering scaling with rigid hand instruments and tips, using air polished devices instead for rubber polishing, ensuring that the instruments are kept sharp or are sharpen free. And you may choose multiple answers. So I'm going to give you some time to consider your answers, and please go ahead and vote. And as said, you can choose multiple answers. Let's keep the question a few seconds still, so all of you get a chance to answer. Okay. I'm going to close it now and share the results. So the results are as following. The one with the largest percentage, and that is 67%, is the last one, and that is ensuring that the instruments are kept sharp or sharpen free. 60% chose selecting instruments with large diameter and lightweight. 50% mentioned planned scheduling of patients with heavy calculus. 45% put using air polishing devices instead for rubber polishing, and 43%, the one that received least, was considering scaling with rigid hand instruments and tips, but also that received 43%. So quite equal numbers for all of the different choices.
Yes, thank you, Dan. Thank you very much, and thank you for answering these questions. And if I inspire you just to be a little bit aware about consideration about periodontal hand instruments in your clinical practice, I would be very, very satisfied, because it's very important to think about it to prevent these injuries. My the third webinar, it's going to be about working with sharpen-free instruments and principles for replacement. And I'm looking forward to share my knowledge with the participants on the next Tuesday. So if you have any questions, you are very welcome to answer them now.
Thank you very much, Tatiana. This was a very interesting presentation. So it's time to open up for some questions. So if you have a question, you may type it in the right-hand side. There should be a field for questions. Also, you have the chance to raise your hand. If you do so, we'll able to unmute you and you're able to ask your question verbally. So there's at least a few questions. Hi, could you explain briefly about sharpen-free instruments? They don't need to be sharpened by tools such as Arkansas stone at all.
Yes, that's right. Sharpen-free instruments, you don't need to sharpen them at all, and we don't recommend sharpening them at all. So it's up to you to learn about sharpening the regularly instruments or using sharpen-free instruments. I prefer working with sharpen-free instruments because I'm always sure that they're very, very sharp. And it's really saving my time and saving my hands. And I'm asking the patients how their experience about sharpening free. And they're telling me that they don't feel I'm putting that much pressure when I'm using these sharpen free instruments. It's like feeling the very, very light. But I experience the instruments very, very effective. But I'm going to talk a little bit more about instruments replacement and working with sharpen-free instruments on the next Tuesday.
Okay, thank you very much. Then there's a second question. Can you talk a bit more about the pinky below thumb finger position?
Oh, okay. It's something like this. When we are working with this, your hand, you have this little finger side and you have your thumb side. So you need to be, when you are working, this little finger side a little bit lower than thumb side. Not opposite, not like this. I hope you can see this illustrating me illustrating this. This is the wrong position. It's needed to be like this. Can you see it now?
Tatiana, I think you need to approve. Yeah. I clicked on the camera to.
Yes, I'm trying again. So this little finger side, it needed to be a little bit lower than your thumb side, just a little bit lower. So your hand, it's rotated a little bit. But you can see it in the picture. We took these pictures of my hands. It's very well illustrated. You need to rotate your hand a little bit. The most important is that your thumb finger is not parallel to the floor. It's not lower than your little fingers. It's the most important principle about this. Yes?
Okay, thank you. Then there's a question, how often should you sharpen your instruments?
Yes, that's a good question. And I made the survey in Denmark. And it was interesting to see the question because most of us, they think it's maybe just 1 or 2 times a year, 1 or 2 times a week. What you needed to do is to sharpen as soon you feel your instrument is dull. And what I'm doing, I'm trying to sharpen after each patient. And if I don't have any time for sharpening, I'm asking dental assistants because they're maintaining our instruments at school, and they know the best way to do it. It's sharpen after each patient. And sometimes I'm sharpening during my periodontal treatment, because if periodontal treatment takes me about 1 hour or 2 hours, it's about 500 strokes. And what I know is after 45 strokes and up to 15 strokes, it depends on the calculus, it depends on, I'm scaling on root surface or the animal. It's important for me to sharpen the instruments. So sometimes I'm coming to my student and helping just sharpening during the periodontal treatment. So the answer is after each patient. So that's why it's very difficult to find the time for sharpening. And what is understandable, is that's why I choose working with sharpen-free instruments. But if I work with another kind of instruments, I'm really trying to find time for sharpening and show the students it is a huge difference with working with sharp instruments. You can really feel it on your hands and wrists.
Thank you. Then there's a question, how long does a sharpen-free instrument last?
Yes, it's a very common question, and thank you for the answer and for the question. And my answer is, it depends. And it depends on many factors. It depends on how severe your periodontal patients are, how many severe patients with periodontal treatment you have during a day, because if it is regular control, you are maybe making 100 strokes, and if it is severe periodontal treatment, you are gonna make up to 600 periodontal strokes. It is a difference, and it's also difference in between the structure of calculus. It depends on how many periodontal instruments you have in your clinic, and how often you not only sterilize, but how do you maintain these instruments. So you can't answer how long time, but you can probably answer how many treatments, regular treatments, it's gonna be held. But it's at least as long as a regular instrument. It's what my experience. Because wear resistant is very, very, very good at sharpen-free instruments. I hope it was the answer.
Yes, thank you. And now, if you have further questions, please go ahead and type them in on the right-hand side, or then you can also raise your hand and we'll be able to unmute you. Yep, here are a few more questions. Is there a difference between the grasp when using an explorer versus a curette?
Yes. We are using about 2 hours teaching using Explore 11 and 12. And of course, it's some different techniques. And different dental hygienist school teach different techniques in using the grasp for exploring. I know in California they're using a modified pen grasp. In Scandinavia, we teach pen grasps and the more relaxed pen grasp for exploring of detecting the calculus and caries, and for vacation problem. We are using the pen grasp. It's 3-finger grasp when you are holding fingers opposite each other. And a little bit difference, or maybe a big difference between pen grasp and modified pen grasp, which you are using for scaling. But it can be a difference between different schools. But what we teach, there is 3 types of grasp. For one for detecting, it's pen grasp, and 2 for scaling. It's modified pen grasp and extended modified pen grasp. And when you are looking on my slide, it's very well demonstrated on the pictures with the titles.
Okay, thank you very much. Then, does it really matter if the instrument's handle made up of silicone or metal, or only the diameter is important? The grip will be almost the same if your hands are in gloves.
Yes, some studies show that the grip is not the same. It's probably that's why Hugh Freight is trying to produce a new instrument with more silicone on. It's because it is much better. The non-slipping instrument is much better for our grasp. Also because when you are using a more loose gloves, it's very important for me to have this silicone handle. It's more secure. So my grasp is more secure on the silicone handle. And my sensitivity of fingers is better, I think. And I have been working with all kinds of instruments. I have been working with Hugh Freighties and American Eagles and LM, and now I'm preferable working with silicone grasp, or at least metal grasp with a big ring with silicone on it.
Okay,
but the first is the diameter. Diameter is what I'm looking, is my first consideration.
Okay, thank you. If I'm used to a certain diameter, then if I change to a thick diameter, will it not affect my hands over the time of use, considering the adaptability?
Oh yes, it would. If you have some symptoms, some strains, numbnesses or something, there is some studies that shows these symptoms are not that bad. They are used to be when you are using a bigger diameter. So it would improve your symptoms. In spite, you used to work with these narrow diameters of instruments. And of course, it is a question of a habit. You need to give yourself a couple of weeks just to get used to another type of grasp. But after sometimes you can really feel a difference. Just give it a chance.
Thank you. Can changing the instrument type affect the tactile sense?
I believe so. you need is because when you are putting a lot of force, a lot of pressure, you are not that relaxed in your grasp. And that's why you can't feel as well. It is the same about gloves. If the gloves is very tight, you can't feel and detect your calculus and caries in the same way. So yes, changing the instrument will improve your tactility sense. That I'm quite sure about. But you need the proper gloves is very, very important to have. Not only handles. Handles, it's a big help for your grasp. But learning how to keep the instrument, how to hold the instrument in your hands is as important too. It's a combination of the grasp and the proper handle. Handle is just a huge help for this improving sensitivity and improving the effectiveness of your grasp.
Okay, thank you. We're almost out of time. If there are still any questions, please type them in quickly. Or then raise your hand and I'll be able to unmute you. If not, you also have a chance to ask questions after the next webinar, which will take place in 1 week. So I think we can end the session here. Tatiana, do you have any final words for the next webinar?
I'm very happy about participating in these webinars and having the possibility to share my knowledge about periodontal instruments, because I think it's very, very important. And I hope these who are participating take it with you to your clinical practice and join me for the next webinar when I'm going to talk about the replacement. Thank you for attending.
Thank you, Tatiana. We are also very pleased to have you presenting this interesting topic for us and for our audience. So thank you for this, and please everyone join in again next week for the final session. Thank you and have a good rest of the day.
Thank you, Ben. Thank you.